Welcome back, everybody, to the OPT Network. Our guest this morning is Dr. Jose Zapatero, and we're talking about the vaccine, the COVID-19 vaccination, and what we all need to know and understand. He joins us from Christus St. Cabrini Hospital. Dr. Zapatero, good morning and welcome.
Good morning.
And so we're hearing a lot about the vaccine, and we saw the big push and the big rollout. And Christus, of course, was one of the first hospitals here in this area to get the vaccination. Tell us about that.
Fortunately, we were one of the first ones in the nation. Louisiana was one of the 5 states that were selected. And people have signed up. We've given over 300 vaccines, but we're getting a lot of hesitation from many of our associates. Some feel that it's been rushed and they just don't have enough information on the vaccine. So I think it's really critical, to learn about it.
So let's talk about that, because that was one of the questions. Were people apprehensive? And the people that I know who are nurses and doctors, I asked them about their apprehension or their feeling of comfort about having the vaccination. As a healthcare professional and team, what do you do to educate them more on why you feel and the FDA feels that it is safe?
So one of the things that we've done is have town halls where we present the information and allow people to ask questions. This is new technology, but it's not unknown. And it's a messenger RNA, and people don't really understand what it is. But our genes are constantly producing these messengers to create proteins. And what this is doing is giving your cells a message to produce the spike protein, the outside protein of the coronavirus of COVID, so that when you get exposed, you have antibodies that are going to bind to that protein and basically protect you from developing COVID. The mRNA is degraded very quickly, so it makes a protein, and then your cells just basically, neutralize it, break it down really quickly.
Mm-hmm. So a lot of people outside of the medical professional are also talking about the vaccination. Do you think that now that a vaccine has been delivered, more people, healthcare, frontline workers are being vaccinated? Do you think that people have a sense of, okay, now I don't have to worry because there is a vaccination?
I think people I'm still getting a lot of hesitancy. The majority of the people who signed up were physicians, were doctors. We did open it up to all of our associates, and we're just not getting the same comfort. What I believe they're waiting to see is a couple of days, weeks go by, and the people who've had the vaccine, that they're okay, and that may improve their comfort level. We're also scheduling meetings with the clergy of the different churches to help get this information out. Different members of their congregations will be having the opportunity to be vaccinated at different times. And it's just important to get the word out by every possible means that we can.
Why do you think that there is so much misinformation, and how do we correct that so that people won't have a fear of being vaccinated?
I really think, getting the facts, and we didn't have the facts until a very short time ago. So the FDA was not able to release the data from these trials until recently. And it takes some time to be able to get that information out. So some of it is that we just haven't been able to do that. And I just think it's really, really critical, to do what you're doing and get that information out there so people can have these conversations. What I've noticed is when people learn about it, then they do become more comfortable and more people are signing up to get the vaccine.
Mm-hmm. So we are post-Christmas now, and are we still seeing the surge, or have we seen a surge from Thanksgiving? And what are the models or the estimation regarding what we will see from Christmas?
We have seen the numbers increase. They've tripled compared to our lowest numbers in November prior to Thanksgiving. So we definitely are seeing a surge. I think that there's so many variables that it's hard to predict what's going to be happening in the future. I can tell you that in Alexandria, one of the things that we've done successfully is the monoclonal antibody, which we spoke about. That would help decrease the transmission, and it's getting people better sooner. We've administered more than all the Christus ministries in Texas combined. So It's been a very
right
effective
here in central Louisiana?
Yes.
So for the people who may not have heard us talk about the monoclonal antibodies, remind us what it is and how can we better understand it?
So what the vaccine is doing is having your body make these antibodies to the protein of the virus to deactivate it. Well, they've made these antibodies that if a person has COVID acutely, so within the first few days, we can infuse into their veins the antibodies, and that inactivates the virus.
But here's the thing that concerns me about that, being that when you first come in contact with the virus, if you have contracted the virus, you're asymptomatic. So how does that then work? Because it may be 14 days or 10 to 14 days before you have any sort of
symptoms.
Thank you. Of the symptoms.
Yeah. It is true, and it's a problem with this virus, and it's one of the problems and why this virus is spreading the way it is. Other viruses become more infective after the person has symptoms. This one, it starts beforehand.
Right.
So it is important to wear the mask, do the social distancing, wash your hands. We still have to take these protections are crucial.
And so still people are very divided about masks. And you'll see people that feel like they don't have to wear them. Others have said, well, some researchers are saying that masks are more harmful than they are good. What do you say to those group of people?
I think when you look at the preponderance of research, it's clear that masks work. When you look at the regions, the states, the cities where they've used the mask and have strictly enforced it, there are fewer people who come down with the disease. And the numbers of people that are dying, I mean, it's 3,000 a day. I mean, that's a huge number. This is a real disease. And it may not, if it's a young person, it may not affect them seriously, but they can transmit it to someone else. So it's also about looking at your family, your friends, your neighbors, and protecting them.
Wow. Let's take a break here, Dr. Zapatero. But when we come back, we want to talk about the newest strain that we've heard about in the United Kingdom, and will we be affected by another strain? And if you get the virus, can you still get vaccinated? Will it help? More questions than maybe we have answers for, but we'll stay on it. Stay with us. We're going to take a break here, and we'll have more of this conversation right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about how we as citizens and lay people can better understand the new vaccine for COVID-19 and what we all need to do to protect ourselves, our families, our neighbors, our workspaces, and anywhere that we inhabit. Our guest this morning is Dr. Zapatero. He joins us from Christus Cabrini Hospital. They were among the first hospitals in the nation to receive the vaccine. And so moving forward, there are still so many questions, Doc, like if I contract the virus and I haven't been vaccinated, because as we know, everybody's not going to be immediately able to get the vaccination, right?
Right.
So what if I get the virus and I start to have a severe case? Will I be eligible to be vaccinated? And if so, will it help me?
People who've had COVID disease, they will be able to get the vaccine, but they can't. They're not going to be candidates until they recover from the disease. No research has been done looking at the vaccine helping people who acutely have COVID. But after they have the disease, normally the amount of antibodies in the blood decreases over time, and getting the vaccine will protect you longer. And they will be doing studies to be seeing whether people need boosters yearly like they do for the flu. So.
And here's another point of contention. A lot of people felt like if they had it early on or initially, that they wouldn't get it again, or that they wouldn't be susceptible to getting the virus again. True or false, or do we know?
People can get reinfected. We are seeing it. It's not incredibly common, but it is happening. And as more months go by, more people's antibodies will begin to go down.
Wow.
And then they can get re-exposed and come down with the disease.
Now, a lot of people, just lay people, had talked about the strain. And this next wave that we saw, a lot of people said here in our state, I think this strain is not as powerful as the first strain. Because we didn't, just people who were talking among themselves were talking about people that they knew and their experience with the virus. But now we've heard the news reports that say that in the United Kingdom, the strain is maybe 70+% more deadly than the last strain. So how are we understanding the strains?
Well, with viruses, they're constantly changing, similar to the flu. What we know from England is the vaccine also protects against the new strain. So these new strains still have that spike protein. So it's one of the things that the vaccine is helping. It's going to be one of the things that we will be monitoring the different strains that will appear. And, if additional vaccines have to be developed, I'm sure they will.
Mm-hmm. Okay, so you all have vaccinated approximately 300 people. How do we get everybody else on board, especially in the hospital, for the protection of themselves and their families and the patients?
I think education is the most important thing. As we said, it's an mRNA. It's not a live virus. You cannot get COVID.
For people who don't know, like myself, what's an mRNA? Help us to understand that.
Okay, and an mRNA, when your genes want to create a protein, they produce this mRNA, and the M stands for messenger, and it sends the messenger to the cell that makes the protein. So this is something that our body is constantly making these and breaking these down. The virus itself, it codes for the spike protein, and it uses our own cells to make their protein. So a person who has COVID, they're having these proteins made all the time. And what the vaccine is doing, once again, it's not a virus. You cannot get COVID from it, but it will produce the protein. I think it's important for people to also know that when they get the vaccine, they should expect they're going to be tender where they get the vaccine, and many people will develop a fever. That doesn't mean that they caught the virus. That doesn't mean they have COVID. That's part of their immune system fighting off this foreign protein, which is to be expected. But some people will hear that and talk to other people, they got a fever, and then they think, oh, they got COVID. So I think it's important to really see what the outcomes are and how people are doing and understand the expectations of exactly what's going to happen with the vaccine.
Mm-hmm. Well, it didn't help much when we saw a nurse or a healthcare provider on TV that fainted after she got the virus. Do you think she was just overcome? Do we know what happened? Do we know, who might be allergic to it, who might not?
The fainting is common. It happens when people get blood draws. It happens when people get needle sticks. There's a medical term for it, vagal response. It's something that we see. If you inject enough people, it's going to happen, and you're going to see it. When that happens, it doesn't matter what was injected. It's our nervous system responding to the fact that we are being injected.
So Dr. Zapatero, we know that you and the staff and the team at Christus are going far above and beyond to educate the community. But we have seen this thing become so political and so divisive. As a physician who has read on it, who's been educated on what you all know about this virus and the facts, the true facts, not the fake facts, not what people want it to be. How do you really implore people that this is okay?
All right. What really is motivating me to get the word out there is I grew up poor. By my name, you can figure out that I'm Latino, and you wouldn't be surprised that I grew up in a very poor neighborhood. So I understand, what a lot of our community is,
Sure,
what they're sensing.
the distrust and the uncertainty.
Exactly. And the poor communities have been impacted by COVID worse than any other community. So it's really important, I think, to reach out there and to try and educate. And that's one of the reasons why we reached out to the clergy. But I'm willing to speak with any group to spread the word and to try and get people to understand. It has devastated, these communities.
Especially the African American community.
Yeah.
Dying faster than more than any other ethnic group.
Correct. And it's one of the things that then, we're constantly trying to reach out and make sure, because it would be a shame if the African American community, who has been devastated by this disease, is then so reluctant to get the vaccine, which is the best hope that we have to bring this infection under control. And then it just creates a worse, a worse disease for the African American.
Wow. And so before you've got to go, for people who say, okay, Dr. Septero, I hear you, I believe you, what is the process and who will be vaccinated first?
So the phase one, the first ones are going to be healthcare workers. That includes everyone who works in the hospital. So our kitchen staff, our custodial staff, our transporters, phlebotomists, it's not just the nurses,
right,
and the doctors, it's everyone. It's important for them to be educated, and when they get that opportunity, for them to be able to feel comfortable making an informed decision. And the other community members, it's going to be rolled out in phases, and the people who are at high risk, the elderly, they should start getting informed. We know it's going to take a while for them to learn and feel comfortable, but we shouldn't wait until they're offered the vaccine to learn about it.
And so let's do this, Dr. Zapatero, let's commit at least every week when you're finding out more about it, that we talk about it and we educate people and we just kind of talk about what's happening here so that people will be able to make an informed decision when it's time. Because I was talking to my mother, who is also a senior, about the vaccination, and she has said, yes, I think I would feel comfortable taking it, but she might be the exception and not the rule. So we really need to get more people on board, as we just had an aunt that died from the virus that is about the same age as my mother.
Mm-hmm. And I do want to extend my deepest sympathies to you and your family. It is devastating to lose any family member, and even more by something like this.
Absolutely. Dr. Zapatero, thank you so much for the work that you and Christus St. Cabrini Hospital are doing to be agents of change and keeping our community healthy and well. Stay safe.
Thank you. You too.
All righty. Take care. We'll talk again soon. Hey, everybody, stay on point. We're back with more right after this.